How to relay the message or how to investigate and find a treatment for this condition?
Well, there's certainly been a lot of money spent investigating the cause or causes of autism, and there's a lot of information out there that's useful, but it hasn't as yet resulted in a cure. There's not a medicine one can take that makes autism go away, and we may never get to that point. But, and that's what I'm saying, is some people want. They just want that thing that they can give their child that makes this all go away, and as yet, that doesn't exist.
But on the other hand, your book starts out with a chapter about Joey Hofbear, and he was a young child while you were a resident, and you talked about when you were a resident, this had a great impact on you. This child had Hodgkin's. Actually, my chief at Harvard, Tom Fry, developed MOP chemotherapy, which you talk about in the book, and Henry Kaplan developed mantle radiation for Hodgkin's disease, and they were both potentially curative. So here's a situation where we had a disease where physicians had worked for decades, had come up with treatment, even in the 60s, and yet the family was pushed away when there was curative therapy. So it's exactly the opposite of autism.
Exactly, and that story upset me at many levels. This was a little boy who had a disorder, Hodgkin's, which was treatable. By that time, in the late 1970s, as you said, there was chemotherapy that were chemotherapeutic regimens that were essentially curative. But the parents didn't want their child to undergo chemotherapy. They didn't want to suffer what invariably happens with chemotherapy of hair loss and loss of energy and nausea and vomiting
And potential cure.
Right. So, but they felt that there would be another cure. There certainly there was a doctor they were able to hook up with who said to them, well, I can cure this in a more natural way. I can give you enzymes and fruit juices and megavitamins and supplements that will also be a cure. When in fact there was no data to suggest that was a cure, and this boy suffered and died as a result. And I think the upsetting part is severalfold. One, that the parents made that choice to essentially let their child die of a treatable disease. Two, that there were doctors out there who were perfectly willing to allow that to happen, presumably also knowing that there was chemotherapy that could be curative, but they were willing to take these parents' money to give them therapies which couldn't help. Three, that the courts failed this boy and that they basically continued to allow the parents to make that decision. And while parents have a legal right to decide how their children live, they really don't have a legal right to decide whether their children live when there are therapies out there that are curative. It was a failure at many levels. It was very upsetting at the time and now.
Would this happen again today?
It happens all the time today.
So you have a triple whammy. The parents, some doctor, and a judge gets together and works their Knievel against the patient?
Well, within the past week, I don't know if you followed this story, but there's a little girl named Sarah Hirschberger, who's a 10-year-old child in Medina County, Ohio, just sort of south, about 35 miles south of Cleveland, who has a non-Hodgkin's lymphoma, which is aggressive, but still chemotherapy, given the nature of her cancer, would allow for about an 85% chance of cure. That's pretty good. But the parents, after going through the first round of chemotherapy and watching their child, suffer nausea, decided they wanted a more natural route. And so they've decided to go with vitamins and herbs. There's a doctor who they found who's willing to do it. It went to the Akron Children's Hospital, basically filed to try and get guardianship of the child because they know that this choice is a choice that is likely going to kill her. And so it went to a judge, a guy named John Lone in Medina County, who sided with the parents. And as far as I'm concerned, that is a direct violation of the 14th Amendment, which means that we have equal protection under the law. Just because your parents have an unusual belief system, in this case it was a religious belief, they prayed to God and God told them that you should use herbs and vitamins, that doesn't mean that child then is entitled to less protection than a child whose parents don't have that particular belief system. I just think this was a failure by the courts and ultimately I think puts this child in unnecessary risk.
And what's going to happen to this girl?
We'll see. This just happened all within the last week, but certainly the vitamins and minerals and supplements she's going to take will not have efficacy on her non-Hodgkin's lymphoma. And actually, after the first round of therapy, her tumors were shrinking, but they've decided to not do this anymore, and it's a terrible choice, and a choice that again society allows wrongly. I just think that John Lone, the judge in that case made a bad decision.
And what did he say? Did he give the child a month to try vitamins, or forevermore, or how was it the ruling?
He had a series of things that he said that didn't make sense. First, he said that this was a matter of parental rights, and it's not a matter of parental rights. Children have rights too, and including this child. He said that there was no guarantee of success. Of course there's no guarantee of success. There's never a guarantee of success with anything. I mean, even if you have bacterial meningitis and are treated with antibiotics, not 100% of people walk away from that either alive or without permanent
Even if
sequelae.
you have a headache and take an aspirin, there's no guarantee.
Their medicine doesn't come with guarantees. This is not Sears. This is medical therapies always, are imperfect, but, you make your best choice. And the third thing he said was that, the child didn't want chemotherapy anymore. This 10-year-old didn't want chemotherapy anymore. Of course she didn't. I mean, no 10-year-old wants to take chemotherapy. I mean, when you're 10, you consider yourself to be invulnerable, and she, acceding to her wishes is just a little silly. She I think doesn't realize how bad of a choice, she's going to make, nor should she be expected to do that. That's what parents are for. Yeah. And absent parents, it's what the courts are for.
So part of the story of Michael Schachter was with Laetrile, and you made the case against Laetrile, and you also used Steve McQueen. And back in those days, Laetrile was in all the periodicals. It was the hot drug around. And did Steve McQueen's death bring an end to Laetrile, or we're still talking about it, still seeing it, or?
You can still buy Laetrile on the internet. It's not hard to find. But because it became such a cause célèbre. I mean, so many people were using Laetrile for what were difficult to treat cancers that eventually cancer specialists studied it and found that it had no activity. In fact, because Laetrile is made from apricot pits, because apricot pits can contain cyanide, and if concentrated, contain enough cyanide to do harm, that product did far more harm than any good. It didn't do any good. But, it just became this sort of countercultural a thing, which is basically what much of alternative medicine is today. It's like the people's medicine. It's going to be our medicine, and we're not going to let doctors tell us what to do. We're going to do this because it's us, and that somehow is very attractive, especially in situations where cancers are difficult to treat.
Part of the beauty of your book, and we're just starting to talk about your book now, which is called, again, for listeners who just tuned in, Do You Believe in Magic? This is Dr. Paul Offit from the University of Pennsylvania and Children's Hospital in Philadelphia. Part of the beauty of your book is it's fully referenced, and you actually give the data of the study. So the FDA, you wrote, approved Laetrile testing. It was the first time it had been done in the history of the United States that they approved testing of a so-called cancer drug that had no evidence of usefulness.
Right. There was no biological reason to believe that it would be an effective cancer drug, and it had never been shown to be successful in experimental animals. That's the first time ever in this country that we allowed just the testing of a drug in people when there was no evidence that it worked in experimental animals. And when it was, because it was such a popular social movement in this country, we thought it was important to do that. I agree with that. I think it was, because then at least physicians had the data that they could point to and say, look, this doesn't work. This is a bad choice.
And Charles Mertel at Mayo Clinic did that study. I mean, you have it in the book. And the book is, we're going to talk a lot about the book, but really the book is great to have on your bookshelf. And it's kind of a book that brings people back to reality on how to live and what to take and what's true and what's not true, because there's so much chaos out there about what we should be taking and what makes you better and what makes you worse. In that study, there was 178 patients you wrote that had Laetrile and vitamins, and the patients died. They lived 4.5 months.
Yeah, it didn't work.
It didn't work.
That did stifle the interest in doing it. So it was good to do a negative study. That was a value.
And then the FDA banned the sale of Laetrile shortly thereafter. So it was kind of like a double whammy that killed it. But I'm an oncologist, and I often will see patients, and there's like these waves. Their waves have come, and one wave is Laetrile. The next wave is shark cartilage, which you talk about also in the book. And next thing you wake up and everyone's on shark cartilage, and they're telling you why do we have to be on shark cartilage.
Right. There was a book published called Sharks Don't Get Cancer, and it sort of created a sort of decades-long fad that and actually there are still people that buy shark cartilage. You can still get that at the GNC Center or in pharmacies. The notion was sharks don't get cancer, and therefore they must have something in them that's preventing cancer, and so shark cartilage became all the rage. I mean, led to the almost extermination of a couple species of shark. But first of all, sharks do get cancer, including cancer of their cartilage, and so it was all bogus. And when it was studied, and it was studied again and again, it was found not to have any activity as one would have suspected. But there were people who chose shark cartilage instead of chemotherapies that would have worked, and that's really alternative medicine at its worst.
What do you feel about people who are taking chemo and taking radiation, and then they're sitting in the waiting room and they're taking shark cartilage and they're taking this and that? Are they trying to cover all their bets? Are they smart? Or are they taking a risk that they really shouldn't be taking? Or
Well, shark cartilage doesn't do anything. So
but
that
Laetrile does. I mean, there's other medicines that do have adverse potential effects.
Sure, and we've seen that in our hospital. Actually, for example, there are people who will come into our children who will come into our hospital, and their parents will give them something like St. John's wort, which is metabolized through the liver and can affect immunosuppressive therapies that children, for example, that are receiving transplants are getting, and therefore it causes them to reject their transplants because essentially the St. John's wort neutralizes the effect of the immunosuppressive therapy, and often we don't know it. We're really trying to train our residents to, when they ask the question, what medicines are you taking, that they also go a little further to ask whether there's any supplements that parents are giving their children, because I think parents often don't consider supplements to be medicines, even though they can have a pharmacological effect.
We have a caller, if you don't mind. It's Cindy calling about vaccination. So if we could take that call and let Dr. Offit hear it, please. Cindy, good evening.
Hello, how are you?
Fine, thanks. You're calling about vaccinations?
Yes, the Gardasil vaccination in particular.
Dr. Offit, do you know about that?
Yeah, I do.
Yeah.
What's the question?
Here's my question. I have two daughters that have already had the series of 3 shots. One is 18 and the other one's 21. My 14-year-old son had the first shot. And then I saw a very small study that there was concern about the Gardasil vaccination. It was making some girls go through early menopause, and it was affecting the reproductive system. And it was a very small study, and I know sometimes you can make a study look like what you want, but what it triggered in me was a concern about, in the 50s, the DES, where they didn't understand the ramifications of the reproductive system until those female fetuses grew up and had damaged cervixes.
Dr. Offit, do you want to take that call?
Sure, yeah, and certainly diethylstilbestrol, or DES, has that kind of pharmacological effect, and so we learned that lesson. Remember, the Gardasil vaccine, which is a vaccine to prevent a virus called human papillomavirus, is made only using a single protein that sort of comprises this sort of outer surface of that virus. It's just a single protein from 4 different strains. It's been given to now roughly 40 million people, mostly women. It's been on the market now since 2006, so we're 7 years into this. It's been tested in prospective controlled studies in hundreds of thousands of girls and now also boys, and it doesn't cause the concern that you're worried about. It's when you say small study, what that really means, it means case reports where a child or a young adult gets the vaccine, and then there's a certain sign or symptom that occurs following that. The question is always, is that a causal association, or is it just a temporal association? Is it just something that happened in time? Because vaccines only prevent vaccine-preventable diseases. They don't prevent everything else that can happen in the first 2 decades of life. So I can assure you that is not a consequence of that vaccine. And you were right to vaccinate your daughters, and you are right to vaccinate your son. I have an 18-year-old daughter and 21-year-old son, both of whom have been fully vaccinated with that vaccine, because this is a virus, human papillomavirus, that causes cancers in girls and boys, and also causes anal and genital warts. And one can prevent that with this vaccine. So you were right to do what you did. I applaud you. I wish everybody had your attitude.
To change the topic a little bit, you spoke a lot about Dr. Oz in your book and what he's gone. And again, one of your criticisms in the book, like Dr. Schechter, is that he wasn't a trained oncologist. He was out there trying to treat cancer, which he did very poorly at best. And here's Dr. Oz, who went to Harvard Medical School, and he's on the staff at Columbia. He's a heart surgeon, so he obviously has excellent credentials. And he's gone off the beaten path. And I just wonder if you can talk about that and speculate, why did he do that, and what do people say? I mean, here's a Harvard-trained doctor, Columbia, who's out